Well, you bend, they twist. Republicans supporting health care reform crying foul over some Democrats insisting they support their health care reform. These next two GOPers are saying far from it. Senator Susan Collins learning that lesson today. Same with my next guest, former Health and Human Services Secretary Tommy Tompson, who's also Republican governor of Wisconsin. Governor, Senator, welcome. Or governor, I should say. The senator had said this. Bob Dole told me this last week when he was with me. I didn't sign on to their reform, Neil. I'm signing on to the notion that Republicans should work for reform. That was kind of your pitch, right?
Absolutely. You know, people like Bob Dole and myself have been in the trenches for a long time advocating for a better health care system for all Americans. And that is what we're still saying.
But not this health care.
Not this one.
So you got ticked off, and apparently Rahm Emanuel, they just pulled the ad right away.
They did, because they got no permission. There was
what
no
did you say? Did you call the White House up?
Absolutely.
Oh, boy. That's why I wouldn't want to be on the receiving end of that.
And, you know, it was just, you know.
What did you say?
Well, basically, I said I never gave anybody permission to use me in an ad that's going to criticize Republican. What I'm trying to do is bring the parties together, saying there's 80% of this health care bill that both political parties could support, which would be good for America. Why don't we work on that 80%, get bipartisan support, and pass a health care bill that's going to really be a credit to this administration, to both political parties, and to America in general?
I'm sounding like a name dropper here, Governor, but I had Mitch McConnell, the Senate minority leader, and he was saying, well, we want to strike a deal, but if it means that they won't budge, better nothing on this deal than, you know, a half-patched one. And so he was saying no to this deal. What do you make of that?
Well, I think he's probably correct. No to this deal, but what I'm saying to...
But you're saying, and Bob Dole is saying, don't go too far with that, because then you look like the party of no.
That's right.
So what's the middle ground?
The middle ground is to say, you know, both political parties in their party platforms advocated changing the system from a disease system to a wellness system. Do something about chronic illnesses, manage diseases, and you will take up about 75% of the cost of health care is in this particular area. Both political parties want that. You're talking about insurance reform. Let's do something about allowing individuals to get insurance easier, and don't put arbitrary kinds of ceilings on it, and be able to allow more people to get involved. Allow people to cross state lines and buy health insurance. Be able to have people come together and have groups to purchase health insurance. Things like this that both political parties can and should be supported.
But you know, Governor, I have a theory on this. Could be wrong.
Sure.
But my theory is that many of the Democrats on the Hill don't want to do anything that helps the private health insurance companies, because they're the evil guys making a ton of money. You're right. So they want to do anything to help their cause, to, you know, cross state boundaries, shared insurance, that sort of thing, and anything that would address some of the private insurance companies' concerns. So they're not going to do that. So that's a non-starter. So Republicans can talk all they want about that, but that's not going to go anywhere.
But there's a coalition there. There's a coalition to get something done. And what I think Bob Dole, and I know what I'm saying, is let's team up together and let's get something done. All of us have come to the conclusion that the health care system in America needs to be changed and needs to be fixed. Why don't we wait and get it done? Why wait? We're here now. We're at pretty much at the 10-yard line, and there's a lot of things in all the bills and all the concepts that we can come together on that would really improve the health care system. I don't want to leave that opportunity on the field. I want to get it passed. I want to make a touchdown.
What if you're wrong? We're not on the 10-yard line. We're actually 90 yards away.
Well, maybe you're right, but I think we're close to the 10-yard line.
Okay, but my point is then that do Republicans negotiate, or do you assume the Rush Limbaugh position in an interview he advocated on NBC? Republicans go back to their conservative roots and quit reaching out across the aisle because you only get slapped.
Well, I think that there's a better way to do it, and there's a tremendous opportunity to get something done and done positively, and that's what I think Bob Dole, I know that's what I want to do. You know, health care is my passion. I want to be able to improve health care. I got great ideas to make it better for all Americans, and I don't want to lose this opportunity to really improve the quality of health care for all Americans, and we can do that. And if we just walk away, we're going to fail, and I don't think failure is an option here.
All right, Governor, Secretary, always good seeing you.
It's my pleasure.
Thank you very much. All right, well, 20 million jobs, and the only thing Washington has to do is butt out. How to create more commerce from the guy who runs the Chamber of Commerce.